Thank you all for being here today. I really, really appreciate seeing so many faces in the room that I know and those that I don't know. I hope that you're going to benefit from this talk. So I really want to talk about something or shed light on an issue that has been silent when it comes to women's health. And first off, I would want you to imagine struggling with a condition that causes you significant mental and physical discomfort, lasting on average 6 days and coming round every single month. And through all this, you are painfully unaware that 1 out of 4 people experience this condition. Now, this condition probably started in your teen years. You approached those closest to you, you expressed your concerns, only to be brushed off. Now, this is not just make-believe. This is a reality for millions. It's often hidden, dismissed. However, those who bear this burden it has a devastating impact on their lives. Now, I want you guys to raise your hands if you or anyone you know has experienced the menstrual cycle. Great. Keep the hands raised, keep the hands raised. I want you to keep your hands raised if you've ever thought or uttered these words. You're not yourself. Is it your time of the month? Great. Put your hands down, you're brave souls. So when you think or when we speak about the menstrual cycle, we tend to focus on those days that we bleed. However, the days prior can be just as dramatic or even more dramatic than the menstrual period days themselves. So, our menstrual cycle on average takes around 21 to 35 days. And in this cycle, the days before your menstrual cycle are known as the luteal phase. The luteal phase is where we are going to discuss premenstrual syndrome, or what is commonly referred to as PMS. So PMS, pre denotes before, syndrome is a collection of symptoms. So PMS is a collection of psychological and physical symptoms that occur 1 to 2 weeks before our menstrual cycle. And researchers have indicated that there are more than 150 of these physical and psychological symptoms. 150, yes. Yes, so when you think about the menstrual cycle, it is important not to just think of it in the background of the period days, but rather that the cycle has our hormones, estrogen and progesterone, fluctuating up and down throughout the 21 to 35 days. Okay? So it's when these hormones dip, and they tend to dip. So they tend to dip after ovulation. And it's when our hormones dip that these notorious symptoms of PMS come to be. So there are those of us who experience migraines. Then there are those of us who can't zip up our trousers because of suddenly gaining 2 inches around the waist due to bloating. Yeah? And this is not the time to get on a weighing scale. Why? Because this is a phase of water retention. We actually refer to it as premenstrual water retention. So there are those of you who have woken up one day and felt like you've gained weight overnight. So maybe you're just justified. And for the men in the room, that dreaded question of, do I look fat? Now you know where it may be originating from. Yes, when we talk about PMS, we really have to look at it holistically because the impact can be significant. So, for personally, in my case, I had a very smooth run with my menstrual cycle. Well, at least until I turned 30. So for 2 decades, all I had to contend with were sugar cravings as well as some mild pain. Why? Because as women, we talk of how heavy our periods are and we talk of period pain, but we do not talk of PMS. We know that PMS can cause mood symptoms. It can cause irritability. It can cause you to cry in the middle of a TV commercial. It can even lead you to shouting at your partner. So for me, I was lucky. For 2 years, I was okay. And for the stats that I shared earlier, I mentioned that 1 in every 4 people struggle from this. However, I included non-menstruators. So when we consider menstruators, then 1 in every 2 women you meet has struggled with PMS. The only difference is the severity. So in my case, when I was around 32, 33, my luck ran out. And this is why it's important to talk about this. Because our hormones do not remain static throughout our reproductive lives. We do experience hormonal imbalances. So I started struggling with debilitating exhaustion, so much so that the easiest task felt like it was torture. I struggled with insomnia. I struggled with migraines. I really had difficulty getting up and going to work. And through all this, it was lasting a few days and then it would disappear. So I was very confused and very unsure if it was all in my head. So these highs and lows continued for several months. And I finally noticed a pattern. These symptoms only occurred 1 week before my menstrual period. And I, a whole gynecologist, had missed it. I missed that I was struggling from symptoms of severe PMS. But now that I knew what the problem was, I was so excited. I can finally manage myself. As I had managed the very few, because it's very few women who come with these complaints in my practice. And I cannot begin to explain the deep, deep shame spiral I went into when I recall the very generic advice I gave these women. Things like clean up your diet, exercise a bit more. And then if they don't get better, I quickly transition to medication. This is what I had been taught. Now that I was on the receiving end, woe is me. I didn't know which exercise should I do and what does it mean to eat clean specifically for managing PMS, and how long does it take before I see a change? I had no answers for these questions. I thought I may have forgotten my training, so I went back to the textbooks, only to find them offering the advice as I had been practicing. So basically glossing over lifestyle changes and quickly transitioning to medication. And from the nods in the room, I can tell many people have experienced this. So, in my case, I had to resort to latest research. I had to review what is the research saying about managing PMS. And I'm grateful that my training gave me the power or the instruments to be able to critique and interpret the research that was being done. So, I started lifestyle modifications. I started off with changing my diet, specifically introducing an anti-inflammatory diet. And what does that mean? So reducing your sugar intake, refined sugar intake, reducing saturated fats, reducing processed meats. I'm human. I'm using the word reduce. I did not eliminate. And I also had to work on reducing my caffeine and alcohol intake, because research has shown that reducing caffeine and alcohol intake coupled with exercise significantly improves symptoms of PMS. So I know some of you are clutching your pearls because I've mentioned reducing coffee. I'm not here to lecture anyone. Everything in moderation, right? So think of it as trading an indulgence for a whole lot of relief, especially when you're having hormonal imbalances. And I want to mention a study that really resonated with me. This is a study that was done at Hitit University in Turkey that found that introducing exercise to non-athlete girls, they experienced relief from PMS symptoms in just 8 weeks, and the relief was significant. Okay? So now we know that introducing exercise has an impact, and I did the same. And just to be clear, I'm not a fan of the gym. So at most, I did 30-minute walks 3 times a week and some strength training. And for me, within 3 to 4 cycles, there was improvement. So ladies, now you know, science shows your activity, your diet can really impact your hormonal balance. Yeah? Yeah. Now, when we think of the mood symptoms, specifically, let me address the mood symptoms of PMS because this keeps coming up. The mood symptoms of PMS, estrogen and progesterone play a role. Estrogen has a role in production of that feel-good hormone known as serotonin, as well as the reward hormone, what is released when you work out, known as dopamine. Progesterone, on the other hand, is known as the relaxant of the brain. So specific for women, we have progesterone receptors in our brain, or rather receptors for progesterone metabolites in our brains. And they work through a collection of neurons, and that's what gives you this tranquil effect. So of course, when there is that dip that we shared, then there would definitely be mood symptoms arising. Now we know that the most recent, unfortunately or fortunately, most of these studies on PMS are very recent, right? But the good news is the fact that we are studying PMS means that we can finally do the appropriate research and find solutions, because there are those women who suffer such severe PMS that lifestyle changes are not enough. These women suffer from a condition known as PMDD, or premenstrual dysphoric disorder. It can be so severe that it presents as depression, debilitating anxiety, including panic attacks, as well as suicidal ideations. For those women, we owe it to them to continue the research. Now, when we think of the history of women in healthcare, I'll share a few statistics. Polycystic ovarian syndrome. It takes 2 years and visits with at least 3 doctors to finally get a diagnosis. For endometriosis, the research shows it takes 7 to 10 years to finally be diagnosed and finally get appropriate treatment. And for the PMDD I mentioned, it takes on average 10 to to 20 years. Now, this is why I am sharing this, because it is time. It is time as women that we come to understand our own hormonal health as intimately as we understand our skincare routines. Right? You've heard the statistics. If you are not your own advocate, if I, a whole gynecologist, my training, I can recite pharmacology of drugs. That is what drugs do to you and how your body responds to drugs. I do not have the same in-depth understanding from my training on nutrition. Through my undergraduate and postgraduate, there is no module and there is no course on nutrition in health in medical school. All I have done is after leaving medical school. So that should tell you that it's time. It's time for us to be our own advocates. Yes? So I'm hoping that you leave here today just having opened the door, because there are other transitions you'll go through, be it pregnancy, be it perimenopause, be it menopause, that require you to know how your body works. 80% of us will experience hormonal imbalances in life. Yet, we know that lifestyle modifications will improve that. This is a diagram that shows you that the receptors of this estrogen and progesterone do not just act in your reproductive organs. It's not just the ovaries and the uterus. These receptors exist in your brain, in your neural system, in your cardiovascular, that means your heart, all the blood vessels that are running through your body. Musculoskeletal, so those joint pains, muscle pains. Remember the 150 symptoms? Yes. And in your gut, where some of these hormones are broken down. So it's so imperative that we understand that we are lucky as women, because our bodies signal when there's something wrong with our hormones. That's lucky. But now we have to listen. Let us not dismiss our own symptoms because from childhood someone told you this is a part of womanhood. If it is normal and you can manage it with lifestyle changes, please go ahead. But if it's extreme, you need to know when to seek medical help. You need to understand how to express the impact of your symptoms on your daily life. And you need to have the courage to ask for further investigations or a second opinion. Thank you.